Good afternoon, everyone. Welcome back here in our ECCMID TV studio, live here at the Bella Center in Copenhagen, Denmark. My name is Judith Cohen. I am the ECCMID TV host, and I'm very happy to announce my next guest who is here live with me in the studio, Professor Henrik Ullum. Welcome, Henrik.
Thank you very much.
You are the CEO of Statens Serum Institut, which is, I think, the Center for Disease Control and Prevention here in Denmark, correct?
Yes, exactly.
Yes.
So we are the institution doing the epidemiological surveillance, and we're also the reference laboratory in Denmark, both for human and veterinary diseases. Yeah.
Okay. And you'll also, this ECCMID, you'll be speaking at a symposium on the matter of SARS-CoV-2 sequencing, I believe, which you call a key for public health response. Would you care to share with our viewers just a little bit about what you'll be speaking of?
Yes, I think in Denmark, first of all, we did a lot of testing that allowed us to basically, in large parts of the epidemic, to detect 2 out of 3 COVID-19 infections. And also we did a lot of sequencing, and that allowed us to real time to detect the occurrence of new variants of concern. So I'll be sharing with the people coming to that session how we use that, and basically we use that every time a new variant of concern occurred to shape the exact public health response in Denmark.
Can you use it also to detect that there's a new variant going around?
Yeah, I mean, when you do sequencing on individual patients, you can see what is there.
Yeah.
In our case, we did not find, very early we did find some new variants. You may be aware we had this mink situation, autumn 2020, where we suddenly saw mink variants. So that was like an occurrence where we had problems of our own with the mink variants occurring. But more I would like to focus on when we have these international variants of concern. For instance, the Alpha variant, I think we were the second country in Europe detecting that, and similar when the Delta and the Omicron variant occurred.
And how come the SSI is so quick to detect these new variants? Do you take random samples on a regular basis, or?
Yes, we have tested a lot, and we have sequenced a lot, and in large part of we have basically sequenced all positive samples. And when you sequence a lot, you find what is there. So honestly, I'm not sure that the second case of Alpha, for instance, did occur in Denmark, but we were the second country to detect it after the UK.
So the motto is do a lot of sequencing, you'll be faster in your public health response.
Exactly. And
is that cost effective also?
I'm not a health and economist because of course sequencing is very expensive, but closing a society and having a society in deep distress is also very expensive, and I'll leave that to the health economists to detect what is
but that may be the reason that other countries were slower.
Exactly, and I think
the same.
In Denmark we were lucky that it was a political commitment to actually do whatever was needed to find early variants and to react to them.
Yeah.
So I think if I should point at one particular case where we were very, very useful to have the sequencing, that was when the Delta variant started to occur.
Yeah.
And now we are 2 years back in time, so we're talking spring 21.
Yeah.
And at this time point, we could see a very early singular cases of Delta. And when we used these cases, so we very intensively tracked them, and we very intensively follow their contacts and make sure that they didn't transmit the Delta variant further on.
Yeah.
And by doing that, we actually delayed the spread of the Delta variant by several months. And in that period, we also need to go back in time. Now we know that, we have all the vaccines we need. But at this time, vaccines was really, really scarce. We didn't have enough vaccines.
And morbidity was real high with Delta.
Exactly. Yeah. So in that period, we actually managed to vaccinate a large proportion of the Danish population, and in particular, of course, the most vulnerable part of the population. Yeah. So that's an example how using these data actually shaped our public health response.
So it sounds like you're an advocate to expand genomic sequencing globally as much as possible. Are there drawbacks to doing that?
Well, the drawbacks are costs, and I think we also we should aim at doing it in a more harmonized way.
Yeah.
I mean, Denmark did
Across
a lot,
borders, you mean?
and UK did a lot. South Africa did a lot. In a global setting, it will be more rational if we kind of leverage that out a little, because we also learn from each other's data. And tomorrow I'll be talking after a South African colleague, and I can really say we learned a lot from the data coming out of South Africa as well. And I think the whole world did so.
What will your South African colleague be speaking about? Do you know that already?
She will be speaking also about the sequencing efforts in COVID also. And of course, some of the very important new variants were actually very early detected by South Africa, which was very, very important for the international response to these variants.
Yeah, so that really enabled everyone to follow and take other steps to try and mitigate as much as possible. That's very interesting. So this has probably been the bulk of your work at SSI also, the past couple of years. Is it still one of your main focuses within the SSI, or are there slow shifts starting to be seen?
At SSI, as in the rest of the world, things are normalizing.
Yeah.
So after a period where everything was COVID-19, 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 of course we now get the strength to focus on other areas, and there are very, very many areas
that need attention.
Yeah, need attention. If I should mention one, would be AMR.
Yeah.
But also, of course, new technologies, new molecular technologies, and also the whole thing about data sharing, learning from data, and even AI principles, I think, are important. And
excellent. Well, thank you for explaining this, taking the time to explain it to our viewers. And you will do so in much more detail, I guess, tomorrow at the symposium, which is at 5:15 to 6:15 in Hall A. So I think that our viewers may have regarded this as a teaser to come and join and attend your symposium. So I think it's really important to see which learnings can be taken from, fast response due to a lot of genomic sequencing. So thank you, Henrik, for coming here and joining us. We will be leaving you now for a short break, and we will be back at 5 o'clock sharp for our final broadcast for today. And we will be inviting 4 guests, 4 of the artists, of people who have submitted their artwork to the art gallery. This afternoon we have some prize-winning artists here to tell you a little bit more about the work they made and created and the background of their art. So please tune in at 5 and we'll see you then.